Come with me to bring my new rescue bird to the vet. Today we're going to do blood work, x-rays, and microchip him. Be sure to stick around for a big surprise at the end too. I almost couldn't fit his travel cage into my car, but we made it work. Macaws really do make it challenging with their long tail feathers. I started out by sedating him with an injectable cocktail of midazolam and butorphanol. As you can see here, he's now taking a good snooze. When doing x-rays, sedation is a must. I do not want to risk any bird injuring itself while being properly positioned. For those new to his story, Loki is a 2-year-old blue-throated macaw that came to me after his previous owner fell ill and couldn't care for him anymore. Once he was fully sedated, we started with x-rays. I also have him hooked up to oxygen, as you can see here. When taking x-rays, it's best practice to use tape to hold their wings and legs in position so that no veterinary workers are exposed to radiation. First, we take a ventrodorsal view with the bird's wings out and its back towards the table. This is what the x-ray looks like once it's taken. Next, we flip him on his side with his wings taped above him and his legs gently pulled back. This is called a right lateral view since the patient is laying on their right side. This is what that view looks like on an x-ray. Fun fact, I bet you didn't know that parrots have bones in their tongues. They really do use their mouth like a hand and their tongue like a finger. Next, it was time to draw some blood for testing. I normally draw blood with a technician holding the bird vertically, but I've been seeing some people draw blood this way, so I figured, why not try it out on my own bird for funsies? I'd say it went well. Next, we went to place a microchip. I usually place them on the back, but I've seen other people place it in the breast muscle. I numbed the area with lidocaine cream, scrubbed it real good, inserted the microchip, and then followed it with a drop of surgical glue to close it. We specially order smaller microchips for exotic pets at my hospital, but the needles are still pretty big, so I only do this under sedation. And here we are, all done and slowly waking up from sedation. I gave him flumazenil to reverse the midazolam. Many bird owners are scared to sedate their birds because you'll hear people say that it's dangerous, but we have much better drugs nowadays. With the ability to reverse them, it's quite safe in experienced hands, but with underlying disease, there can always be risks. Even so, it's often even more risky not to sedate them and stress them out or not get the answers that you need. Here she is waking up and attempting to enjoy a Nutriberry. Wait, did I say she? Okay, you got me. The big surprise is that we got her blood work back and Loki is actually a girl. I was so shocked because I was told by the previous owner that they bought him as a boy. I almost didn't send out the test, but I'm glad I decided to double check. Luckily, the rest of her blood work came back normal and her chlamydia test was negative as well. I spoke with the previous owner, and since she wasn't really attached to the name Loki at all, I've decided to rename her Azula. 1, because she's blue, and 2, because all of my pets are named after Avatar. If you know, you know. Be sure to follow along for more of our adventures with Azula, as I'll be coming out with some more cool training videos with my friends at Birdtricks.